Hey guys, Tony Maritato here, licensed physical therapist, and next to me on the screen is a video I'm going to show you some clips of a new patient that I saw in the clinic today. Now, I'm an outpatient orthopedic physical therapist. I primarily focus on treating individuals who have had rotator cuff repair surgery and total knee replacement. This is from my YouTube channel, The Shoulder Guide, and one of the things that you can see here is we're 9 days post-op. Today was the first day of physical therapy in an outpatient clinic. The patient's doing tremendously well. What I wanted to do here is to show the pickleball players who are interested in getting back to pickleball what the recovery process looks like following a rotator cuff repair. This particular individual had a rotator cuff repair, and if you don't already know, the rotator cuff is made up of 4 muscle and tendon attachments. Those 4 muscle and tendon attachments kind of surround the shoulder, and it really helps to stabilize and control the small movements of the shoulder. So it is rotator cuff, not rotary cup. And basically those muscles, the most common site of injury is the muscle on top called the superspinatus. That is usually where the main tear happens. In this particular case, this individual also had some problems going on with the front of the shoulder called the biceps tendon. So he had a tenodesis, but basically what happens is the biceps tendon tends to get frayed or damaged because of the bony structure of the shoulder between the collarbone and the acromion process. So when they go in to do the rotator cuff repair, they also clean up the bicep. But as a result, for 4 weeks following surgery, he is not allowed to actively flex his elbow, meaning he is not allowed to pick anything up, to bring anything to his face. He's supposed to eat with his left hand. He's going to be in a sling. Now, the sling is not on him, but you can kind of see it in the back on the table. He's going to be in a sling for about 4 to 6 weeks, 4 weeks conservatively, 6 weeks most likely. The first 4 weeks, he's not allowed to do any active elbow flexion. We will do all passive range of motion, but we'll work the musculature around the shoulder. So like the upper traps, the pecs, the lower hand, the wrist, the elbow, everything else, just not the muscles that were involved in the repair. My top priority for anybody who has a rotator cuff repair, especially if you've been an athlete, you want to go back to playing pickleball or any racket sport, is to really focus on building back your functional capacity, your endurance, your cardiovascular system. So one of the things that he and I discussed before we finished the session was trying to get 15 to 20 minutes of consistent cardio on a bike at first, a recumbent bike. He belongs to a local gym, then transitioning to some sort of elliptical or arc trainer or stairmaster, something that allows him some relative stability. He's less likely to fall as if he was on a treadmill or something less stable. But the idea is that I want him to break a small sweat at least, get his respiration rate up, get his heart rate up for a solid 20 minutes. And he can do that every single day. It's going to help with tissue healing. It's going to help improve his digestion. It's going to help prepare his body for healing. Then when we're allowed to start doing things on the shoulder itself and get him ready to return to pickleball, he'll probably be in better shape than he was before the surgery. A couple things I wanted to show you guys. You can see here he's got 1, 2, 3, 4 incision sites. There's one on the back that you can't see, which makes 5. That's where the tools, the instruments go into the shoulder to perform the procedure. Then as the camera kind of pans around, you can see pretty significant bruising down the front of the arm. That's pretty normal. It doesn't happen for everybody, but usually when there's biceps involvement, the bicep tendon and muscle is in this area. You'll see some residual bruising and bleeding. I explained to him it's not painful. If you push on it, it's not like a contusion. It's simply the blood draining down, and you can see it through the skin. It'll continue to change color. It'll eventually fade. One of the things that we always watch for is to make sure that we don't see any rashes or irritation of the skin. We want to differentiate that from just standard bruising. And then he is still sleeping in a recliner. He's unable to get comfortable in bed. No big deal, totally normal, especially the first 2 weeks to be in a recliner and then eventually transition to the bed. My prescribed home exercise program for him on day 1 for the first really 3 to 5 days is very simple. It's what we call a pendulum exercise. You allow the arm to hang, you allow gravity to kind of pull, and you just do some very gentle circular motions. We talked about doing some shoulder shrugs, some scap retraction, and any kind of cardiovascular fitness that doesn't put the repair site at risk, but that still allows him to get that cardio, little sweat going, get the heart rate up. So guys, if you'd like to see more information about this, I think it's always helpful to see what's actually going on in a real physical therapy clinic. I can never give actual physical therapy advice because I don't know you and this is YouTube, but I will do my best to share examples like this. I'll catch you guys on the next video.